Have you ever woken up one morning, looked in the mirror, and wondered if that new ache or unusual feeling might be trying to tell you something important? You're not alone. Our bodies have a remarkable way of communicating with us, especially as we journey beyond our 6th decade of life. Those whispers from our bodies that we could once ignore in our younger years, well, they deserve our full attention now. I remember meeting Harold, a vibrant 72-year-old who loved tending to his garden and playing with his grandchildren on weekends. "I never thought anything was wrong," he told me, his eyes reflecting a mixture of regret and newfound wisdom. "I just assumed feeling tired was part of getting older." What Harold didn't realize was that his body had been sending him urgent messages for months, messages that, had he recognized them sooner, could have made his recovery journey much easier. That conversation with Harold changed something in me. It made me realize how many of us might be missing crucial signals our bodies are sending, signals that could mean the difference between addressing a health concern early or facing a more challenging path later on. Today, we're going to explore 7 warning signs that your health might be at risk after 60. These aren't meant to frighten you, but to empower you with knowledge. Because here's the beautiful truth. Awareness is your strongest ally in maintaining vibrant health at any age. And the sooner you recognize these signals, the more options you'll have to address them effectively. So let's settle in together, like old friends having an important conversation. I promise to keep things straightforward, practical, and most importantly, actionable. Because knowledge without action is like having a map but never taking the journey. Let's begin with the first warning sign that many people over 60 tend to dismiss far too easily. Warning sign number 1: unusual fatigue that doesn't improve with rest. "I'm just getting older" is perhaps the most dangerous phrase in our vocabulary after 60. Yes, our energy levels naturally shift as we age, but there's a significant difference between age-appropriate tiredness and the kind of fatigue that's trying to alert you to something more serious. Think about your energy patterns over the past few weeks. Does a good night's sleep restore your energy, or do you wake up feeling just as exhausted as when you went to bed? Does a simple trip to the grocery store leave you needing to sit down for an hour to recover? These aren't inevitable parts of aging. They're your body waving a red flag. Unusual fatigue could be signaling several health concerns that become more common after 60. Heart conditions, including early heart failure, often first appear as unexplained tiredness. Anemia, which affects many older adults due to nutritional deficiencies or small amounts of blood loss, can drain your energy reserves. Thyroid disorders, particularly hypothyroidism, become increasingly common as we age and can leave you feeling constantly exhausted. But here's what many people don't realize. Medication interactions can also create this persistent fatigue. As we accumulate more prescriptions over the years, the ways they interact can sometimes drain our energy without us making the connection. What's your body asking you to do? First, start keeping a simple energy journal. Note when your fatigue is worst and any patterns you observe. Is it worse after certain meals? Particular times of day? After taking specific medications? This information will be invaluable when you speak with your doctor. And yes, speaking with your healthcare provider is essential when unusual fatigue persists for more than 2 weeks. Don't walk in and simply say you're tired. Bring your energy journal and specific examples of how this fatigue differs from your normal patterns. Ask explicitly about checking your heart function, thyroid levels, and complete blood count to rule out common causes. How might your life change if you address this fatigue instead of accepting it? What activities might you return to? What joy might you reclaim? These are possibilities worth exploring. Wouldn't you agree? Warning sign number 2, changes in your bathroom, habits that persist. This might not be dinner table conversation, but it's a critical topic for your health. Changes in your bathroom patterns, whether it's urinary habits or bowel movements, are among the most commonly ignored warning signs after 60. Let's talk about urinary changes first. Are you making more midnight trips to the bathroom than before? Do you sometimes feel urgency, but then have difficulty starting or maintaining your stream? Have you experienced any leakage that's affecting your confidence or social activities? These changes deserve attention. In men, prostate enlargement often begins causing noticeable symptoms in their 60s and beyond. For women, weakening pelvic floor muscles can lead to various forms of incontinence. But for everyone, changes in urination can sometimes signal more serious conditions like urinary tract infections, which present differently in older adults, often without the burning sensation younger people experience. Diabetes, or occasionally, cancer of the bladder or prostate. Similarly, your bowel movements tell an important health story. New and persistent constipation or diarrhea, especially when accompanied by other symptoms like unintended weight loss or blood in your stool, should prompt a conversation with your doctor. These changes could indicate anything from medication side effects, a common but overlooked cause, to inflammatory bowel conditions or, in some cases, colorectal cancer, which responds best to early intervention. Have you noticed any shifts in these patterns and dismissed them as just getting older? I encourage you to reconsider. While some changes are indeed age-related, persistent alterations deserve medical attention. Your doctor has heard it all before. There's no need for embarrassment about discussing these important health indicators. The solution might be simpler than you think. Sometimes, a minor medication adjustment, a few dietary changes, or some targeted exercises can significantly improve these symptoms and your quality of life. But the first step is acknowledging that these changes aren't simply inevitable parts of aging that you must endure. Think about how addressing these issues might improve your confidence in social situations or your ability to travel and enjoy activities without constant worry about bathroom access. Isn't that freedom worth a potentially uncomfortable conversation with your doctor? As we journey through life's later chapters, our relationship with our bodies changes. The signs and signals shift in both subtle and dramatic ways. And while our first instinct might be to adapt and endure, I'm inviting you to consider a different approach, one of curiosity, advocacy, and proactive attention to these important messages your body sends. What might change in your daily life if you address that nagging concern you've been pushing aside? How might your energy, confidence, and joy expand when you treat these warning signs as opportunities rather than burdens? While we continue our conversation about these important health signals, I want you to know that recognizing them isn't about fear, it's about empowerment. Each sign we discuss is an opportunity to take control of your well-being, to make informed choices, and potentially to catch something before it becomes more challenging to address. Now, let's explore the next warning signs that deserve your attention. These might be happening gradually enough that you've adapted to them without realizing their significance. Warning. Sign number 3. Unexplained weight changes. Weight fluctuations tell a powerful health story, especially after 60. While many of us focus on weight gain, unexplained weight loss can actually be more concerning from a medical perspective. Have you noticed your clothes fitting differently, even though you haven't changed your eating habits? Or perhaps you've been gaining weight despite not changing your diet or reducing your activity. I met Eleanor, a sprightly 68-year-old, who was initially pleased when she lost 15 pounds without trying. At first, I thought it was wonderful, finally losing that weight I'd been carrying since menopause, she shared with me. It wasn't until my daughter insisted I see my doctor that I discovered my thyroid was severely overactive. Eleanor's story had a happy ending because she addressed this warning sign before it affected her heart health. Unexplained weight loss, typically defined as losing 5% or more of your body weight within 6 to 12 months without trying, can signal several health concerns including thyroid disorders, digestive problems, depression, or sometimes more serious conditions like cancer. Even dental problems or medication side effects can lead to unintended weight loss by affecting your appetite or ability to eat. On the other hand, sudden weight gain, especially when concentrated around your midsection, might indicate hormonal changes, heart failure, which can cause fluid retention, or kidney problems. Sometimes it's a medication side effect, particularly from drugs that treat diabetes, depression, or high blood pressure. What makes this warning sign tricky is how slowly it can develop. You might not notice a pound or two each month, but over time, this adds up to significant changes. This is why regular weigh-ins, perhaps once a week at the same time of day, can help you spot trends before they become pronounced. If you've experienced weight changes without obvious lifestyle explanations, consider keeping a simple log of your weight and any symptoms you notice alongside it. Are you more tired? Experiencing increased thirst? Having digestive issues? These connections are valuable clues for your healthcare provider. When you speak with your doctor, ask specifically about checking your thyroid function, blood sugar levels, and whether any of your medications might be contributing to these changes. Sometimes, a simple adjustment can make a significant difference. How might addressing these weight changes improve not just your health, but your energy and confidence? Would identifying the cause allow you to reclaim certainty about your body that you may have lost? Warning. Sign number 4. New or worsening pain. That doesn't follow the normal pattern. Pain is just part of getting older, maybe one of the most repeated phrases after 60, but it's also one of the most misleading. Yes, we might experience more aches and pains as we age, but there's an important distinction between the occasional twinge of arthritis and pain that signals something requiring medical attention. Let's clarify what's worth watching for. Pain that's new and persistent, pain that wakes you from sleep, pain that doesn't follow a pattern you're familiar with, or pain accompanied by other symptoms like fever or weight loss. Consider joint pain, for instance. Morning stiffness that improves as you move throughout the day often signals osteoarthritis, common as we age. But what about pain that gets worse with activity, or pain accompanied by swelling and redness? These patterns might indicate rheumatoid arthritis, gout, or infection, all requiring different treatments. Chest pain or discomfort deserves special mention here. We often expect heart attacks to present with dramatic, crushing chest pain, but especially for women and older adults, the symptoms can be much subtler: pressure or discomfort in the chest, pain radiating to the jaw, neck, or back, unusual fatigue, or shortness of breath. Never dismiss these symptoms as indigestion or muscle strain without proper evaluation. Back pain affects most adults at some point, but certain warning signs suggest something beyond routine muscle strain. These include pain radiating down your leg, potentially signaling nerve compression, back pain accompanied by fever, back pain with loss of bladder or bowel control, or pain that began after a fall. These scenarios warrant prompt medical attention. If you're experiencing new or changed pain patterns, start by documenting when it occurs, what seems to trigger or relieve it, and any other symptoms that accompany it. Are there times of day when it's worse? Activities that provoke it? This information will help your doctor determine appropriate next steps. Many pain conditions respond well to early intervention, whether through physical therapy, medication adjustments, or addressing underlying causes. The key is recognizing when pain falls outside the pattern of normal aging and deserves professional evaluation. I wonder, is there pain you've been dismissing as just getting older that might benefit from a fresh conversation with your healthcare provider? What activities might you reclaim if that pain were properly addressed? Warning. Sign number 5. Sensory changes that impact your daily life. Our senses connect us to the world, to loved ones, and to life's pleasures. When these connections begin to fray, when hearing, vision, taste, smell, or touch change significantly, it's not just an inconvenience. It's your body communicating important information about your health. Vision changes can be particularly subtle in their onset. Are you finding it increasingly difficult to read menus in restaurants, even with your glasses? Struggling to drive at night due to glare? Noticing straight lines appearing wavy? While gradual changes in near vision are normal after 40, hence reading glasses, other vision changes may signal conditions like cataracts, glaucoma, or macular degeneration. What makes vision concerns particularly important is that conditions like glaucoma can cause irreversible damage before you notice symptoms, which is why regular eye exams, even when your vision seems stable, are so important after 60. Hearing changes often develop so gradually that family members notice before you do. You might find yourself turning up the TV volume, struggling to follow conversations in noisy environments, or frequently asking people to repeat themselves. While some hearing changes are age-related, others can signal ear infections, medication side effects, or circulatory problems. Margaret, a 74-year-old former teacher I know, began withdrawing from her beloved book club. I was embarrassed because I couldn't follow the conversation when multiple people spoke, she confided. After finally getting hearing aids, she told me, I had no idea how much I was missing. Not just words, but birds singing in my garden. Addressing sensory changes isn't just about health. It's about remaining connected to what brings you joy. Changes in taste and smell, particularly after COVID-19, have received more attention recently. But even before the pandemic, diminished taste and smell were recognized as potential early indicators of neurological conditions. They can also result from medication side effects, nasal polyps, or sinus issues, all treatable conditions. When sensory changes occur, document specific examples to share with your doctor. Instead of simply saying, "My hearing is worse," note situations where you notice the impact. I can't hear my grandson when he sits on my left side, or I couldn't taste the difference between the chicken and fish at dinner. Which sensory changes have you noticed, but perhaps dismissed as inevitable? How might addressing them reconnect you with pleasures and connections you've been missing? As we've been exploring these important health signals together, I hope you're beginning to see a common thread emerging. Each of these warning signs represents your body's wisdom, its way of alerting you to potential issues before they become more serious. It's a conversation your body is trying to have with you, and today, we're learning to listen more carefully to that conversation. The journey we take after 60 can be one of our life's most fulfilling chapters when we approach it with awareness and proactive care. Let's explore our final 2 warning signs that deserve your attention. Signs that many dismiss, but that could make all the difference in maintaining your independence and joy in these golden years. Warning. Sign number 6. Cognitive changes that affect your daily functioning. When we talk about cognitive changes, many immediately worry about Alzheimer's disease. While that's certainly one possibility, there's a much wider spectrum of cognitive changes, many of which are treatable or reversible when addressed promptly. Have you noticed it's becoming harder to follow the plot of your favorite TV shows? Perhaps you found yourself standing in a room, unable to remember why you went there in the first place. Maybe balancing your checkbook is taking twice as long as it used to. Or you've missed bill payments despite having sufficient funds. These changes can be subtle enough that you adapt to them without realizing their significance. Often, it's family members who notice first, when you repeat the same story multiple times in a conversation or struggle with tasks that were once second nature. I remember David, a brilliant 77-year-old former accountant who began making unusual financial decisions. His daughter became concerned when she discovered several magazine subscriptions he'd never ordered and some missed mortgage payments. Dad always handled money perfectly, she told me. Something wasn't right. A medical evaluation revealed severe vitamin B12 deficiency, a common but often overlooked cause of cognitive changes in older adults. With treatment, David's mental clarity largely returned. This illustrates an important point. Many conditions can affect cognition temporarily or partially, including medication interactions or side effects, especially sleep aids, antihistamines, and certain pain medications. Vitamin deficiencies, particularly B12, thyroid disorders, depression and anxiety, sleep apnea or chronic poor sleep, urinary tract infections, which can cause confusion in older adults without the typical painful urination, small strokes or TIAs, transient ischemic attacks. If you or loved ones have noticed cognitive changes, keeping a simple journal can help identify patterns. Do problems worsen at particular times of day? After taking certain medications? When you're tired or hungry? This information can provide valuable clues for your healthcare provider. When discussing these changes with your doctor, be specific about how they're affecting your daily life. Instead of saying, "I'm more forgetful," try, "I've forgotten to take my blood pressure medication 3 times this month, which never happened before," or "I got lost driving to the grocery store I've been going to for 15 years. Ask your doctor about comprehensive cognitive testing and whether any of your medications might be contributing to these changes. Also request screening for conditions like vitamin deficiencies, thyroid disorders, and depression, all common and treatable causes of cognitive symptoms. How might identifying and addressing these cognitive changes improve not just your health, but your confidence and independence? What peace of mind might come from understanding what's happening and taking action? Warning: sign number 7, social withdrawal and mood changes that persist. Our emotional and social health is deeply interconnected with our physical well-being, perhaps more than most of us realize. That's why persistent changes in your mood or social patterns deserve as much attention as physical symptoms. Have you found yourself declining invitations you would normally accept? Do activities that once brought you joy now seem uninteresting? Are you sleeping much more or much less than usual? Do family members comment that you seem different, more irritable, or withdrawn? Depression doesn't always present as obvious sadness. In fact, for many adults over 60, it manifests more commonly as loss of interest in usual activities, unexplained physical complaints, or changes in sleep and energy levels. And contrary to what many believe, depression is not a normal part of aging. It's a treatable condition that responds well to intervention. Martha, a 71-year-old widow, initially attributed her fatigue and loss of appetite to just getting older. She gradually stopped attending her weekly bridge club and church activities. "I just didn't have the energy," she explained. Only when her daughter insisted on a medical evaluation did she discover she had both depression and an underlying thyroid disorder. With treatment for both conditions, Martha told me 6 months later, "I feel like myself again. I didn't realize how much I'd lost until I got it back." Social withdrawal can sometimes signal physical health problems as well. Hearing loss often leads to social isolation when conversations become difficult to follow. Urinary incontinence might keep you home for fear of embarrassing accidents. Chronic pain can make outings seem more burdensome than pleasurable. Each of these physical issues can lead to social withdrawal, which then often progresses to depression, creating a cycle that significantly impacts quality of life. If you've noticed changes in your mood or social patterns lasting more than 2 weeks, consider whether there might be physical contributors to these changes. Are you avoiding activities because of pain, incontinence concerns, hearing difficulties, or fatigue? Addressing these underlying issues can sometimes resolve what appears to be depression. When speaking with your healthcare provider about mood changes, be honest about their impact on your daily life. Many older adults hesitate to discuss emotional health, having grown up in generations where these matters were often kept private. But your doctor can't help with concerns you don't share. Ask specifically about evaluating both physical and psychological contributions to your mood changes. Simple screening tools can help identify depression, and your doctor can recommend appropriate treatment options, which might include medication, talk therapy, or addressing underlying physical conditions. What aspects of your life might improve if you addressed persistent mood changes? What connections and joys might you reclaim? Bringing it all together, your empowered path forward. As we conclude our time together, I want to emphasize something important. Recognizing these warning signs isn't about adding worry to your life. It's about empowerment. the power to address potential health concerns early, when treatment options are often simpler and more effective. Each of the 7 warning signs we've discussed – unusual fatigue, changes in bathroom habits, unexplained weight fluctuations, new pain patterns, sensory changes, cognitive shifts, and mood, or social withdrawal – deserves attention when persistent. Not because they necessarily indicate serious problems, but because they represent opportunities to improve your quality of life, maintain your independence, and continue enjoying the activities and connections that bring you meaning. The wisdom you've accumulated through 6 or more decades of life is perhaps your greatest health asset. You know your body better than anyone. You've experienced its patterns, its strengths, and its vulnerabilities. When something feels different, that intuition matters and deserves to be shared with healthcare providers who can help interpret these changes. I encourage you to think about which of these warning signs may have resonated with your experience. Is there something you've been noticing but dismissing? A change you've adapted to rather than addressed? Consider making that doctor's appointment you've been putting off, or bringing up that concern at your next visit. Remember too that advocating for yourself in healthcare settings becomes increasingly important as we age. Prepare for appointments by writing down your concerns. Bring a list of your medications, including over-the-counter products and supplements, and consider bringing a family member or friend for support if that helps you communicate more effectively. Your health journey after 60 can be one of vitality, engagement, and joy when you treat your body as the wise messenger it is, listening to its signals and responding with appropriate care. You've earned this wisdom through decades of life experience. Now is the time to apply it to your most important asset, your health. I'd love to hear your experiences with any of these warning signs in the comments below. Has there been a health signal you initially dismissed that turned out to be important? Or a concern you addressed early that made a significant difference? Your story might help someone else recognize a warning sign in their own life. If you found this information valuable, please consider giving this video a thumbs up and subscribing to our channel for more content focused on living your best life after 60. We're in this journey together, and there's so much wisdom we can share with each other along the way. Remember, paying attention to these warning signs isn't about fear. It's about freedom. The freedom to live these years with the energy, clarity, and engagement you deserve. Because the best chapters of your story may still be waiting to be written.